Is forgetfulness just a harmless sign of aging, or the first whisper of something more serious? Every year, more than 55 million people worldwide are living with dementia, according to the World Health Organization. Yet despite its growing prevalence, many still believe that memory loss, confusion, and personality changes are simply a natural part of getting older. But here's the truth: dementia is not inevitable. And it's not the same as normal aging. In today's video, we're going to separate fact from fiction. You'll learn what dementia really is, discover the 4 most common types, and most importantly, uncover 9 subtle but critical early signs that could easily go unnoticed. We'll also explore 13 classic symptoms and share science-backed strategies that can help you protect your brain health, starting today. And if you think there's nothing you can do, think again. Recent studies have shown that up to 40% of dementia cases may be preventable through lifestyle changes alone. Imagine if something as simple as improving your sleep, managing blood pressure, or adjusting your diet could delay or even prevent cognitive decline. So what exactly is dementia? It's not a single disease, but rather a syndrome, a group of symptoms caused by damage to brain cells. These symptoms affect memory, language, judgment, and behavior, making even simple daily tasks difficult. While age is a major risk factor, dementia is not a normal part of growing old. Most older adults retain their cognitive abilities and live full, independent lives. That's why recognizing the difference between normal aging and early dementia is so vital. You'll also meet the 4 major types of dementia: Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. Each has distinct patterns and warning signs, but early recognition is the key to better outcomes. Whether you're concerned about a loved one or your own mental sharpness, this video is for you. Stick around until the end, because we'll also reveal the latest breakthroughs in dementia treatment, offering real hope to millions around the globe. Because when it comes to brain health, knowledge isn't just power, it's prevention. 1. Struggling with words. The difficulty finding the right words during a conversation may be more than just a momentary lapse. It can signal early cognitive decline. Struggling with words often goes beyond occasional forgetfulness. The person may hesitate frequently, rely on vague terms, or substitute inappropriate words that don't quite fit. They might repeatedly swap similar words, confuse the names of familiar objects, or even experience long pauses as they try to recall specific terms. At first, this sign may seem subtle and could be mistaken for normal aging or distraction. However, as it becomes more frequent, it starts to interfere with daily communication, impacting their ability to express themselves clearly and connect with others. This communication difficulty can lead to frustration and social withdrawal, both for the person affected and those around them. Recognizing this persistent language struggle early on is crucial for timely diagnosis and support. 2. Changes in the senses. Sensory changes, particularly in vision, hearing, smell, and taste, can serve as subtle but important indicators of dementia. The person may experience difficulty recognizing familiar faces, which can be disorienting and unsettling for them. They might struggle with judging distances and depth, leading to accidents, difficulty navigating, or missteps when reaching for objects. Hearing issues are also common, especially when trying to follow conversations in busy or noisy environments. This difficulty can lead to misunderstandings and frustration, further isolating the individual from social interactions. Additionally, changes in taste and smell may cause them to lose interest in foods they once enjoyed, impacting their appetite and nutrition. These sensory changes, though seemingly minor, can significantly affect quality of life and point to underlying cognitive decline. Paying attention to these subtle shifts in sensory perception can be valuable in identifying dementia early. 3. Lack of motivation. Loss of motivation, also known as apathy, is another early sign of dementia and often goes unnoticed as it develops gradually. The person may become less inclined to engage in activities they once loved or initiate new tasks. Hobbies and interests that used to bring joy might be neglected, and daily activities may feel burdensome. This lack of initiative can extend to social interactions, with the person avoiding gatherings or family events and preferring isolation instead. They may appear apathetic, displaying little energy, enthusiasm, or excitement. This behavior change can easily be mistaken for depression, but in dementia, it lacks the characteristic sadness or emotional distress associated with depression. Over time, this apathy can impact their relationships and daily functioning, leading to a sense of detachment from life's usual routines. Recognizing this loss of motivation as an early sign of cognitive decline can prompt a deeper exploration and, if needed, early intervention. 4. Muscle weakness. Muscle weakness can sometimes be more than just a physical issue. It may be linked to the brain. Muscle strength issues, especially in conditions like vascular dementia and Lewy body dementia, can be one of the early signs of cognitive decline. This weakness might manifest as fatigue, difficulty in performing precise movements, or an overall reduction in motor control. Tasks that were once second nature, such as buttoning a shirt, brushing teeth, or using utensils, may suddenly seem difficult or frustrating. Frequent falls, trouble maintaining balance, and an increased reliance on support for movement are also common. These motor issues may emerge before other cognitive symptoms or appear alongside them, making them a critical indicator of the need for medical evaluation. Early intervention can help manage these symptoms and potentially slow their progression. 5. Lost in familiar places. Spatial disorientation is a prominent and concerning sign often observed in the early stages of dementia. A person may find themselves lost in familiar settings, like their own neighborhood, or may experience confusion even in well-known environments, such as the layout of their home. They may struggle with simple directions, unable to find rooms or exits they previously navigated with ease. The capacity to mentally map and recall spatial environments diminishes, resulting in anxiety, frustration, and a growing sense of insecurity. For individuals, this disorientation can be both alarming and distressing, as it impacts their ability to move about independently. Recognizing this symptom early and seeking support can be pivotal for maintaining quality of life and providing proper guidance for safety. 6. Sleep problems. Sleep issues are another potential indicator that something deeper may be affecting brain health. Sleep disturbances are common in dementia and may appear early on, including trouble falling asleep, frequent awakenings throughout the night, or excessive drowsiness during the day. This disruption can extend beyond just irregular sleep patterns. A phenomenon known as sundowning is also common. Sundowning involves increased agitation, confusion, and restlessness during the late afternoon and evening. These changes in the sleep-wake cycle can disrupt daily life, impact mood, and create stress for both the individual and caregivers. Managing these sleep issues is critical, as restorative sleep supports cognitive health. Proper care, a structured routine, and sometimes medical intervention can help manage these challenging symptoms, improving overall well-being. 7. Hunched posture and difficulty walking. Postural changes and difficulty with walking may also signal underlying cognitive decline, especially in Lewy body dementia and vascular dementia. Early signs may include a subtle hunched posture, stiffness in muscles, or hesitation with initiating movement. As the condition progresses, walking patterns may shift, becoming slower with small, shuffling steps or a more unsteady gait. These postural changes not only affect mobility but also increase the risk of falls and injuries, contributing to a loss of independence. Such changes can start subtly and may worsen over time, highlighting the need for early intervention. A physical therapist can assess these postural and mobility issues, recommend appropriate exercises, and provide guidance to help manage symptoms and maintain balance and mobility for as long as possible. 8 simple tasks becoming complex. Tasks that once required little thought can start to feel overwhelming as dementia progresses. Routine activities, such as preparing a simple meal, paying bills, or using household appliances, may become complex and confusing. The person might struggle with the order of steps, forget how to use everyday items, or lose track midway through a task. This decline in task management often leads to mistakes, frustration, and a growing sense of dependency, impacting self-esteem and independence. Difficulty with these daily activities is a strong indicator of cognitive decline, and it underscores the importance of early diagnosis and appropriate support. Attention to these changes can facilitate timely interventions, enabling the individual to access the care and assistance needed to maintain quality of life and autonomy for as long as possible. 9. No interest in even talking. Apathy, also known as anhedonia, is a frequent early sign of dementia. The person may lose interest in pleasurable activities, hobbies, or social interactions they once enjoyed. They may appear emotionally distant, lacking motivation or enthusiasm. Apathy can be confused with depression, but in dementia, there is usually no associated deep sadness. This lack of engagement can affect quality of life and relationships. Recognizing and addressing apathy is an important part of dementia care. The 13 classic symptoms of dementia you need to recognize. 1. Difficulty following conversations. Difficulty following conversations is another common symptom of dementia. The person may struggle to keep up with discussions, especially in groups or noisy environments. They may lose track of the conversation, have trouble finding words, or express thoughts clearly. This can lead to misunderstandings, frustration, and social withdrawal. It's important to speak clearly and slowly, use short sentences, and give the person time to process information. Minimizing distractions and background noise can also help. Loss of time awareness. Loss of time awareness is a characteristic symptom of dementia. The person may confuse the day, month, or current year. They may struggle to remember important dates like birthdays or appointments. The passage of time may seem distorted, with the person believing recent events happened a long time ago, or vice versa. This temporal disorientation can disrupt daily routines and cause confusion. Using calendars, clocks, and structured routines can help maintain a sense of time. 3. Difficulty making decisions. Difficulty making decisions is a common symptom of dementia. The person may struggle to evaluate options, weigh pros and cons, or come to a conclusion. Simple choices like what to wear or what to eat can become challenging. More complex decisions like financial or health matters may become even more compromised. This difficulty can lead to indecision, anxiety, and reliance on others. Offering limited, clear options and giving time for decision-making can be helpful. 4. Social isolation. Social isolation is a common symptom of dementia. The person may lose interest in social interactions, avoiding leaving the house or participating in activities they once enjoyed. They may feel uncomfortable in social situations due to cognitive and communication difficulties. The stigma and lack of understanding about dementia can also contribute to isolation. This withdrawal can affect quality of life and accelerate cognitive decline. Encouraging participation in adapted activities and support groups can be beneficial. 5. Inappropriate behavior. Inappropriate behavior is a possible symptom of dementia. The person may show disinhibition, saying or doing inappropriate things in public. Inappropriate sexual behaviors, like making advances or exhibitionism, may occur. Verbal or physical aggressiveness, especially during personal care, is also common. These behaviors can be embarrassing and challenging for caregivers. It's important to remember these are symptoms of the disease, not intentional actions. Redirection strategies, calm communication, and environmental adjustments can help. 6. Short-term memory problems. Short-term memory problems are hallmark symptoms of dementia. The person may forget recent information, such as conversations, events, or appointments. They may repeat questions or stories multiple times, not remembering they already discussed the topic. Long-term memory of older events may remain intact at first. These memory lapses can cause confusion, frustration, and dependency on others. Using written reminders, photos, and life stories can help. 7. Hallucinations. Hallucinations are possible symptoms of dementia, especially in Lewy body dementia. The person may see, hear, or feel things that are not present. Visual hallucinations, such as seeing people, animals, or non-existent objects, are the most common. They can be vivid and frightening. Auditory hallucinations, like hearing voices, may also occur. It's important to validate the person's feelings without confronting the reality of the hallucinations. Redirection strategies and medications may be necessary. 8. Urinary or fecal incontinence. Urinary or fecal incontinence can be a symptom of more advanced dementia. The person may have difficulty recognizing the need to go to the bathroom or finding it in time. Control of sphincters may be compromised. This can cause embarrassment, hygiene problems, and caregiver burden. Approaches like regular reminders, easy-to-access clothing, and incontinence products can help manage this delicate issue. 9. Mood or behavior changes. Mood or behavior changes are common symptoms of dementia. The person may show rapid emotional swings, going from calm to irritation or sadness without apparent reason. Inappropriate behaviors, such as sexual disinhibition or aggressiveness, can occur. Apathy and social withdrawal are also frequent. These changes can be challenging for caregivers and affect relationships. Understanding that these are symptoms of dementia rather than intentional actions is crucial. Communication and behavioral management strategies can be helpful. 10. Placing objects in inappropriate places. Placing objects in inappropriate places is a frequent symptom of dementia. The person may store items in strange places and later forget where they put them. Keys in the refrigerator, clothes in the trash, or food in drawers are common examples. This behavior can cause confusion, frustration, and accusations of theft. It's important to be patient, create organizational strategies, and avoid confrontations. Identifying specific places for essential items can help. 11. Difficulty planning or solving problems. Difficulty planning or solving problems is another common symptom of dementia. The person may struggle to follow a plan, work with numbers, or handle financial matters. Complex tasks, such as organizing a trip or an event, may become extremely challenging. the ability to reason and find solutions becomes compromised. This can lead to mistakes, frustration, and loss of independence. Support and task simplification may be necessary. 12. Difficulty planning or solving problems. Total disorientation in time and space is a classic symptom of dementia. The person may get lost in familiar places, confuse the day, time, or season. They may struggle to find their way home or to known locations. Disorientation can happen in relation to both time and space. This can cause anxiety, confusion, and increase the risk of ending up in dangerous situations. Strategies like labels, calendars, and routines can help minimize disorientation. 13. Repeating questions. Repeating questions is a frequent symptom of dementia. The person may ask the same question multiple times in a short period, even after receiving an answer. This occurs due to short-term memory problems and difficulty retaining new information. The repetition can be tiring and frustrating for caregivers. It's important to respond with patience and calm. Using simple and direct phrases, written or visual reminders may also be helpful. Several conditions can cause dementia, with Alzheimer's disease being the most common. In Alzheimer's, abnormal protein accumulation occurs in the brain, leading to nerve cell death. Vascular dementia is caused by brain damage due to circulatory problems, like strokes. Other causes include Lewy body dementia, characterized by the accumulation of the protein alpha-synuclein, and frontotemporal dementia, which affects the brain's frontal and temporal lobes. Risk factors include advanced age, family history, cardiovascular diseases, and an unhealthy lifestyle. Understanding the causes of dementia is essential for raising awareness and identifying risk factors. However, it's equally important to recognize that there are steps we can take to reduce the risk of developing this condition. While dementia has no guaranteed prevention, adopting certain lifestyle practices can significantly contribute to brain health and resilience. Dementia remains a complex and challenging condition affecting millions worldwide, but greater awareness and proactive care can make a powerful difference. By recognizing the early signs, understanding underlying causes, and committing to preventative measures, we're not just protecting brain health, we're investing in a future of mental clarity, independence, and fulfillment. Each step we take toward a healthier lifestyle, whether through diet, exercise, mental engagement, or social connections, strengthens our resilience against cognitive decline and enhances overall well-being. While a definitive cure is still on the horizon, recent advances in research offer hope for slowing dementia's progression and improving the lives of those affected. In a world where prevention and awareness are key, our efforts today have lasting impacts on our future quality of life. If this information has inspired you, please like, share, and subscribe to Healthy Care. Join our community as we explore practical tips, health insights, and strategies that empower you to live a longer, healthier life. Together, let's make every day a step toward a brighter, healthier tomorrow.